doctors might be very good in the operating room or the delivery room, but they're not really trained in public speaking, so hopefully you'll
You did a great job.
The other thing I do want to say, remember, we don't know the answers to this, and most docs are way too busy. So we're looking to you guys to think about it and come up with some answers, okay?
To do no harm, and I won't do it.
Go back just a little bit. This is good.
They tell me that I
At Georgetown Medical School, we did take the Hippocratic
breast
Oath,
surgeon,
which is to do no harm.
oncologist, nobody giving input. For the prostate cancer, there wasn't a single urologist. These task force guidelines will force me, as a physician, to violate my Hippocratic Oath, to do no harm, and I won't do it. They tell me that I can only recommend screening for women over 50 and every other year until they're 75. I won't do it. I'm going to stick with the American Cancer Society guidelines of every year after the age of 40 until the patient decides that she doesn't want to have screening mammography done anymore. That's what's going to save lives. I won't violate my Hippocratic Oath, and neither will thousands of other physicians. We're going to have to make a choice. Do we abide by the government guidelines, or do we do what we think is right for our patients? And that may cost us. We may not be able to participate in this system if we disobey their rules. That's in the law. Let's talk about why the American Medical Association signed on to this. Gosh, I can't imagine. They only represent 17% of physicians. Now, in their heyday in the 60s and 70s, they represented 70% of physicians. Now it's 17% of physicians. And most of those aren't practicing physicians. They are instructors in academic facilities, medical students or residents in training, or retired physicians. The AMA also has a government-granted monopoly on the publication of these code books. Earlier I talked about these CPT codes. So we have to use these little codes, these little numbers to match up a diagnosis with a lab test or a treatment in order to get paid by third-party carriers and Medicare. So the AMA has a monopoly on publication of these code books. Everybody has to have them. So the AMA makes $80 to $100 million on publishing these code books, and they only bring in something like $20 million from fees and member dues and things like that. I wonder where their loyalties lie. One of the ways that we talked about when we were talking about how the law is going to control costs was through accountable care organizations. So an accountable care organization, and there are several versions of them out there that they're talking about and proposing through the healthcare law, but essentially it's kind of what we call an HMO on steroids. It's you're grouping together the hospital, the doctors, all the providers into a big lump, and they're going to get one payment, say, for a hip replacement. So, okay, so for a hip replacement, you get paid X amount of dollars, and all that money is going to trickle down through everybody, and the hospital or somebody will decide who gets paid how much. That's how they're going to control costs. Then they might get bonuses if they don't spend all that money. Well, how would they maybe not spend that money? They might spend that money by not treating people quite as much as they would have if this weren't in place. Or maybe they're not going to do a couple of extra lab tests that they might really want to do to make sure they have the right diagnosis. In other words, there's going to be an incentive for providers not to give care, not to do diagnostic tests, because they're going to get paid more if they don't do it. As a patient and as a physician, I just find that warped. That is not the right way to decrease costs. In addition, this accountable care organization will focus all of the medical care on the hospitals. Well, the hospitals love that. That's why they liked PPACA. They signed on to this a long time ago, because it brings all of the patient care under their jurisdiction, so to speak. So instead of having all of these outlying outpatient centers for imaging or surgery centers or things like that that charge a whole lot less than the hospitals, now the hospitals will have control over the patients. So it's going to be the end of private practice. Already, half of the doctors in this country are not in private practice. They're employed by Kaiser or a hospital directly. So it's going to be the end of private practice, and it could be the end of these competitive outpatient facilities that can give care, excellent care, at a much lower price. Electronic health records. Bottom line, do you really want the government in charge of your health care records or your health care? But they're also going to have access to your personal medical records. So, right now, doctors are supposed to set up a system that is approved by the federal government. There are all kinds of systems out there for electronic health records. And they sold this, and it does sound like a great idea. Let's have, gosh, if I'm here in Colorado, but I go traveling to Florida, and I get sick in Florida, wouldn't it be great for Florida to be able to contact Colorado anytime, day or night, access my electronic health records, and see what medications I'm on, what health problems I have, blah, blah, blah. That makes all kinds of sense, doesn't it? I think it's a great idea. The logistics of it are not quite working out that way. So, right now it's costing between $35,000 and $50,000 per physician to set up these systems. And then there's ongoing maintenance fees and payments that go for $300 to $1,500 a month. And then we have this meaningful use where you have to check off all this mountain of information every time you see a patient.
I wanted to talk about that a second. That's why my doctor is getting out of medicine. I was sitting at the Fairfield County Medical Society meeting down in Norwalk, and I was talking to an orthopedic doctor from Stanford. There were 8 doctors in his group. He said it's costing him $250,000 for the hardware and the software for the the medical records. It's just a nightmare, and that's what's pushing a lot of the docs out. One recent study said 83% of docs are thinking of getting out. One of my partners in Norwalk, who is probably the most clinically knowledgeable and a super surgeon, keeps telling the nurses he wants to just have a little heart attack so he can get out. He doesn't want to die, but he wants to get out and go on disability, because the docs are just, it's just so discouraging. And I thought of something too. I was talking to some of the Yale would send the neonatologists, that's the high-risk pediatricians. So they did 4 years of college, 4 years of medical school, 3 years of pediatrics, and 2 or 3 years in neonatology. So they trained for a lot of years, and they have about $250,000 of student debt. And as you keep cutting the docs back, docs are not stupid. One of my patients founded Subway, and I don't usually hang out with patients, but she kept saying, "Oh, come on our boat." Her boat was about as big as Norwalk Hospital. So I'm talking to this one really smart guy, and he's mentioned he's a hedge fund manager, makes a ton of money, sleeps at night, unlike obstetricians. He had gotten into Harvard Medical School, but he didn't go because he was making about 1,000 times as much money as a hedge fund manager buying and selling stocks. So the docs are not usually pretty stupid, and they can go do a lot of other things. Just something to keep in mind. I always tease people, make sure you start learning Urdu and Swahili so you can talk to your new doctors. Yes?
I have a comment about the electronic records. My primary care physicians are changing over now, and very proudly, she handed me the paper with my records. I didn't know I had a hip replacement. And a very important thing, because I do take colonoscopy exams more than the average person, my mother died of complications of colon cancer. That was not on my records.
Wow.
So I would advise anybody whose doctor is changing over, get a copy and check it over and make sure everything on there is accurate. And also to the woman who said that she hasn't had any trouble yet. I have an 83-year-old friend whose doctor died, and it took her months to find a doctor that would accept Medicare. This is beginning to happen. It's already happening. And as far as being happy with Anthem, your HMO, that's not going to exist if this goes into effect. The problem here is we're all preaching to the choir. We have to go home. We have to talk to our kids who may not have our political inclinations and really try to just preach and preach and preach. And I hope that in one of the new presidential debates that Romney will be as articulate as he was the other night and get into this, because it's frightening. The end.
Yeah, it is frightening. My wife and I were actually paying about $17,000 to $20,000 a year out of pocket for healthy, and we're pretty healthy. My son, who's a nursing student at Quinnipiac. But I mean, that's a pretty onerous bill if you have to start paying it. So